scientists all around the world. It is a primarily respiratory virus. It enters through the nose, gets lodged in the pharyngeal area, and if it then eventually travels down to the lungs, where it interacts with the alveoli. So what happens is the alveoli is basically they multiply. The virus multiplies to such an extent that no transfer of gases is possible. So when that stage comes, it's called hypoxia, or the oxygen requirement really rises. And that's when you, if you put the pulse oximeter, you'll notice that the levels drop from like normal, which are like 97, 98, it drops to like 92, 80, even 70. And then eventually the body can go into a septic shock or even like cytokine storm. So the treatment modalities are you may be given oxygen, BiPAP machine, or eventually go on ventilation. And most people do recover from the virus. But one thing that's common in most patients who have recovered from the virus, few things that are common, that is extreme debilitating fatigue. There is a lot of pain in the legs. There is a lot of weakness, tiredness. There's like an insufficiency in microcirculation throughout the body, and even memory loss to some extent. So these were primarily the physical symptoms that we talked about. This COVID-19 virus has not only been a physical, has not only had physical effects, but psychological effects as well. All of us have been through the various emotions like anxiety, anger, denial, frustration, uncertainty because of its constant mutations and the constant statistics. So this virus is basically has had a deep toll physically and psychologically as well. Now, how does yoga and yoga therapy come into the picture? Telling a little bit of a difference between yoga and yoga therapy. Yoga therapy is simply picking and choosing certain aspects from your daily yoga practice that is essential for the particular condition that you're in. That is what yoga therapy is. Now, yoga is all about activating the relaxation response. I talked about how the COVID-19 functions in the body. It's basically a intense inflammation. So what you're doing through yoga, the entire practice of yoga, which includes asana, pranayam, and meditation, is you're trying to reduce the inflammatory response of the body. So there are two systems of the body, two main systems. I always talk about this whenever I'm giving a talk on yoga and yoga therapy: the sympathetic system and the parasympathetic system. The sympathetic system is the fight and flight response. Parasympathetic system is the rest, digest, healing response. So COVID patients have gone through, COVID patients as well as others, we are all going through this intense sympathetic activity, so where there is inflammation in the lungs, there is inflammation spread throughout the body. Once you are recovering, rehabilitating, you want to get back to the balance of the parasympathetic system as well, which is what yoga's main crux is. Yoga plays a very vital role in getting the bodily as well as the mental systems back to the parasympathetic system. So so yoga has anti-inflammatory as well as anti-thrombotic effects. So what we are going to be doing today are certain stretches to create good circulation in the entire body, and also a little bit of more focus on chest openers, because that's the main site of attack in during the infection. All of these movements, asanas that we are doing, need to be done very gently, slowly, without any jerks. This sequence is easy, safe for most people. If there are any contraindications for any particular movement that we are doing, I will let you all know before we do the movement. And one thing to remember is, don't hold your breath at any point. Just keep breathing naturally, normally. And the last thing I'll mention before we begin the practical session is be aware of your pain. Respect if the body is paining. If there's pain in any limb, just respect that pain and don't push yourself through that pain. Yoga is all about respecting the body and being very self-aware. So if there are any questions, you can type them in your chat box, and then I will try to address them. If possible, I'd request you all to switch on your videos so that I don't feel like I'm looking into an abyss, and I can correct you if need be. Okay, let us all sit either in your cross legged seated postures or on your chairs. You want to roll your shoulders, lift the chest without arching the spine, and you want to get your hands in the Jnana Mudra. Jnana Mudra is your index finger and thumb is gently touching, and you want to get your wrists on your knees. We're going to begin with three Omkars. So just close your eyes. Let's take a deep breath in. Exhale completely. Inhaling deep. Exhaling completely. On your next deep inhalation, let's begin with a long, loud Omkar. Inhale. Inhale. And gently open your eyes. Okay, let's begin with a few warm up movements first and then go for the asanas. So, the first movement is a very simple movement. We are going to inhale, and as we inhale, we're going to lift our shoulders up towards our ears. So, get your hands down. For those who are sitting, just sitting on the floor, just keep your hands beside you. And inhaling, you're just going to lift the shoulders towards your ears, and exhaling, you're going to lower the shoulders down. This might seem like an easy movement, but make sure you're aware of the intercostals expanding, the collarbones rising, the scapula muscles at the back rising as you inhale, and exhaling, lower the shoulders down. Inhaling, raise the shoulders up as high as you can towards the ears. Exhaling, lower the shoulders down. Inhaling, raising the shoulders. Exhaling, lowering the shoulders. Inhaling, raising the shoulders. Exhaling down. Inhaling, lift the ribs. Exhaling down. Let the movement be very slow and enjoy the gentle movement of the shoulders. Inhaling up. Exhaling down. So all the movements, asanas that we are doing are going to be very gentle, restorative, that bring a profound sense of relaxation on the level of the muscles, organs, tissues, and the mind as well. Okay, the next movement is known as Garudasana hands. So what you're going to do is you're going to take your arms in front of you and you're going to get one elbow in and try to hold your palms, touch your palms. If your palms can't touch, it's okay, just keep the hands as they are. The point of importance is getting a stretch at the shoulders. not so much whether you can touch your palms or not together. Okay, inhaling, lift the elbows up, exhaling, lowering them down. Inhaling, lift the elbows up, exhaling, lowering them down. Let's do this movement 8 times. 3. You can close your eyes and just feel where the stretch of the muscle is. 4. 5. Inhaling up. 6. 7. And one last time, inhaling, raise the arms up, raise the elbows up. Exhaling, get the elbows down. Okay, just shake your arms out to the side. The next movement that we are going to be doing will require a chair. So if you're sitting on the floor, just sit on the bed or chair, anything that's close by. We are going to do a side bend in the seated posture. So you're going to take a little distance between the legs, a good amount of distance actually. Spread the legs apart. And you're going to keep one elbow on the in front on the thigh, and you're going to lift the left arm up and stretch the side lateral intercostal muscles and come to the center, going to the other side, stretching the intercostal muscles, pointing your fingers away from your head as much as possible, coming to the center. Inhale, lift the arm up and stretch, stretch, stretch. Let the chest be open. Let the chest not drop down like that. Let it be parallel. Inhaling, coming to the center. And then going down to the side, stretch. Once again, going down to the side. Let's hold this stretch for a few breaths. So holding the stretch and taking your deep breaths. Feel the stretch in the side intercostals. Feel the rib cage expand and contract as you inhale and exhale. Try to really think about the ribs at the side expanding as you do this, as you do breathing in this movement. Okay, and come to the center. And let's go to the other side. Again, expansion on the left of the rib. Exhale completely. Inhaling deep. Exhaling completely. Inhaling deep. Exhaling completely and come to the center. Let's do a little bit of deep breathing with palpating the ribs at the bottom. So get your palms near your lowest ribs. Okay, you can feel them. You can feel the last bony rib. After that, it's basically squishy, and then you have your iliac crest all the way to the bottom. So the last rib, your palms are there, and as you inhale, try to feel the ribs expand and lift, and as you exhale, try to feel the ribs contract. And you might not feel it the very first time you're doing it right away, but just try to close your eyes, send your awareness to the lowest ribs, And take a few deep breaths. So the primary affected area is the alveoli, which is concentrated at the lower lobes of the lung, the peripheries of the lung. So by this deep breathing that we are doing, this palpation of deep breathing that we are doing, we are trying to send the breath all the way to the part which we usually don't, occupy with our breath. Inhaling, the ribs expand, the intercostals expand, the chest slightly rises. Exhaling, the ribs sink, intercostals sink, the chest sinks. Okay, relax. In the beginning, I've had this feedback from a lot of patients that sometimes what happens is you feel actually tired when you begin to take deep breaths. That's because you've never really accessed that part, especially in patients who have suffered from COVID. There is this tiredness when you try to take a deep breath. So don't force the deep breaths, but just, like gently touching your boundaries as much as possible. That's how you want to take those deep breaths. Okay, let's move on to the next movement, for which you're going to require a chair. This is basically known as a modified Adho Mukha Svanasana. If you are practicing yoga, you know that Adho Mukha Svanasana is an inverted V that we do on the mat, but we are going to do it with the chair, with the support of your wall. So I'm going to keep my chair against the wall, and I'm going to stretch my arms. I'm going to place my palms at the edge of the chair, and I'm just going to take my feet back and stretch my entire body, stretch the sides of the waist, stretch the sides of the chest long. I'm going to hold this stretch. There might be a little pain in the shoulders, but just don't push it too much. Okay, and coming to the center, relax. Let's do it 1 or 2 times more. Once again, palms at the edge, walk back and stretch the sides of the waist long. Let the heels come towards the floor if possible, and walking forward once again. Let's do this movement 4 times, and then the fifth time we'll hold. 3, walking back, long stretch, make the spine long, let the neck not contract, let the neck be nice and long and soft. And coming to the center, one more time, 4, push back through the waist. Coming forward, one last time, we're going to hold for a few breaths. Here, take your 5 deep breaths. Inhaling, feel the lungs, back of the ribs expand. Exhaling, feel the contraction. 3, 4, and 5. Okay. Come to the center, come to stand, and just shake out your arms a little bit. We go for slightly more relaxed postures soon. Okay, going for one chest opening in the standing posture. If your heart rate is increased, you can do this in the chair as well. So it's a simple movement. Uh, Roll the shoulders, really open the chest. Get your arms at the back, interlock the fingers, let the scapula really press against each other and open the chest, trying to lift your arms a few uh, inches away from the butt and relax. Release the arms. Now, one thing you need to be careful over here is make sure that the lower back is not overarching. That's a tendency to do it when you're doing this stretch. So make sure that the tailbone is tucked in, the lower back is not overarching as you do this stretch. Okay. And release. Roll the shoulders, collarbones away from each other, elbows nice and straight, chest lifted. Look straight, don't look down. Release. The last time we're going to hold this with a few breaths. So when I say hold, I mean hold the stretch, not the breath. You are taking your deep normal breaths all throughout. Roll the shoulders, lift the chest, stretch the arms back, and 5 deep breaths here. 1, inhale deep, exhale completely. 2, inhaling deep, exhaling completely. 3, inhaling deep, exhaling completely. 4, inhaling deep, exhaling completely. 5, and release the arms. Okay, let's get 2 pillows and 1 rolled towel to support the neck. Let's go for one restorative relaxatory posture known as Supta Virasan. It's a good chest opener, and you're also like getting the entire body to rest in this pose. So keep 2. If you have a so if these pillows are slightly squishy, make sure you get 3 of them. If they're hard cotton ones, then 2 should be good. So originally Supta Virasana is done with the bent knees. You're going to keep your bent knees to the side and lie back. But usually it's very strong for the knees. So I'm not going to do the bent knee version. We're going to keep our legs straight and just lie back down on our back. So keeping the legs straight, pulling this entire. So I've kept it horizontally, not vertically. And I'm going to gently lie down. Let the back of my neck rest on this roll. My chin is a little bit towards the chest, is not pointing way too backward. And my hands are to the side. My chest is open here. And I'm taking deep breaths here. My entire spine is supported by these pillows. We're just going to hold this posture for a good few minutes. So just lie down and completely focus on your breathing, completely focus on relaxing the body. As you begin to take your deep breaths, try to send your breath all the way down to the pelvic area, all the way down to the bottom of the abdomen. And then also get your attention to the chest. Your shoulders are relaxed and open at the back, so the chest is open in a relaxed posture here. Again, feel the expansion and contraction of the lungs. More than a pseudo expansion of the chest, you want to think about the lungs expanding and contracting here. That your mind not wander. If it wanders, just get it back to the breath. Make sure you're not holding any extra tension in your toes and feet and ankles. Make sure the area around your eyes is completely relaxed. And you're just taking these deep breaths with a deep gratitude for the oxygen, for the prana that you're receiving. Exhale completely. Let's do breathing with a few counts. Inhale to the count of 3, trying to exhale to the count of 4 or 5. Inhale 2, 3. Exhale 2, 3, 4, 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 5. Okay, let's begin to gently release the pose. Don't just sit up. You're going to bend one knee and then bend the other knee. And then you're going to turn to your right side or left side, whatever you're comfortable. And then use the support of your arms to come up to sit. This was your Supta Virasana, a very, very gentle and very, very relaxatory posture. Going for a few more asanas. So you can come onto your palms and knees. Make sure your wrist, elbow, shoulder is in one line, and your knee and your hip joint is in one line. You can either keep your toes turned in or turned out. Keep your feet, keep your knees together for this one. So what we're going to do is we're going to inhale, raise the left arm up, open the chest, open the torso as much as possible. Exhale, get the arm down. Inhaling, raise the left arm, open the chest. Exhaling, get the left arm down. Inhaling, opening up. Exhaling, coming down 5 times. Inhaling, opening up. Exhaling, coming down. One last time. Inhaling and exhaling, coming down. Going to the other side. Inhaling, raising the arm up. And exhaling, getting the arm down. Inhaling, raising the arm up. Exhaling down. Feel a twist and an opening. That's the main thing. It's not so much about the arm as much as it is about the intercostals. 3, inhaling, exhaling down. 4, inhaling, exhaling down. 5. And just sit back on your, get your buttocks onto your heels. Take 2 deep breaths. And then moving on to one classic chest opener pose known as Ushtrasan or the camel pose. Now this can be a little bit difficult for newcomers, patients who are weak. So we're going to do like a very easy modified version of Ushtrasan. You're going to come to stand on your knees. You're going to place your hands like you would place them if you were wearing pants that had pockets in the back. So that's the point where you want to place your palms at. And just a little bit of a back bend. And coming to the center. For those who have knee issues, weak knees, painful knees, cervical spondylitis, right now, avoid doing this asana. For those who don't, inhaling, going back. And exhaling to the center. One last time, inhaling, going back. And exhaling, coming to the center. Coming to Vajrasana. Okay. Going for Shashankasana or Balasana, a forward bend with a relaxatory pose in the forward bend. So for this, so that we can hold for a little longer, what you're going to do is you're going to roll your mat, the back of your mat, which you're going to place underneath the ankles. And you're going to take one pillow and place the forehead on the pillow and stretch the arms out. Take a little distance between the knees so that the chest is well accommodated and your nose is completely free. Your nose shouldn't be touching any object. Some patients do complain of a little bit of claustrophobia in this pose, so which is why you want to only hold as long as you're comfortable and then take your deep breaths here. Now here, think more about the back of the ribs expanding and contracting as you inhale and exhale. For those whose buttocks don't reach the heels, you can also keep a blanket like that. And thinking of the back ribs expanding as you inhale deep. Exhaling, completely. Inhaling deep. Exhaling completely. Okay. And now gently coming out of the posture, coming up to sit, and rolling out your mat. Going into the prone posture, which is lying down on your abdomen. Now, a little bit of a contraindication before we do this one. This is a variation of Bhujangasana where we're going to lift the chest, lift the torso slightly off the floor. Anybody with disc prolapse issues, any spinal issues, and if you're pregnant, if you're menstruating, avoid doing this particular one right now. Okay. So our arms are to the side like that. And inhaling, we're going to lift the head and the chest. Exhaling, coming down. Inhaling, press the feet into the floor and lift the chest off the floor. Exhaling, coming down. We are going to do this movement a few times and then go for holding. Inhaling, rising as high as you can, letting the muscles of the back really work. Exhaling, coming down. Inhaling, exhaling down. Inhaling, let's take our palms at the back, palms facing the floor, and rise up. Exhaling down. Inhaling, don't force yourself to come too high in this posture because you might end up with a spasm of the back muscles. Exhaling down. One last time, let's hold for a few breaths. So rise up to 70% of your total capacity and just take 3 breaths here. Feeling the breath move your bottom of the lung. Five, and relax. Get your arms forward. Turn your cheek to one side, place your cheek on the floor, and just take a few deep breaths here. If the arms are aching, you can also place them down to the side or all the way forward as you're comfortable. Okay, moving on to the next. A little bit of breathing technique here. We're going to do something known as proning. I think you have read about this, have probably done this. So you're going to place a pillow a little bit under the chest, a little bit at the juncture where the diaphragm comes. And you're going to place another pillow for your forehead. And you're just going to think about, again, the back of the ribs expanding here. Exhale completely. Let your nose be free. Let your nose not be pressed against the pillow. exhale completely. Let's do it with a few counts. Inhale 2, 3. Exhale 2, 3, 4, 5. Inhale 2, 3. Exhale 2, 3, 4, 5. You can also place one palm at the back and see if you can, feel the slight expansion of the back ribs. You'll also notice that the more deep breaths you take, there's a big difference between the first deep breath that you took and, say, the 10th or the 15th deep breath. Okay. And gently coming out of the posture, bending your knees, turning to one side, coming up to sit, and removing the pillows out of the way. We're going to do one or two supine movements. Supine is we're going to lie down on the back. Before you go in the supine posture, get one book and one like a rope, like a dupatta or something. So one dupatta and one book. I have a block here. If you have a block, you can get the block, or you can get a book around of this weight. We're going to lie down on our backs, and we're going to do a little bit of diaphragmatic breathing. Now, there's the abdomen, there's the chest, and between both of them is a muscle known as the diaphragm, one of the most important muscles of respiration, which we often tend to not use to the optimum capacity. So, using a block, keeping it a little bit between the chest and the abdomen, and as we inhale, we're going to try to raise the block up, and as you exhale, you're going to have a slow, controlled lowering down of the block or the book. So your hands are to the side, your feet are straight. You're only concentrating on the upper abdominal muscles rising as you inhale, and upper abdominal muscles sinking as you exhale. Now, there is a tendency to kind of overarch the back, kind of really use the back muscles while doing this. Don't breathe so strenuously that your back is overarching and you're using the back muscles. Keep the back very relaxed. If you want, you can keep the knees bent here so that the lower back is closer to the floor, and you're just doing your book breathing. Again, no strain. Let it be a soft, gentle, deep breath, and let your exhalations be longer than the inhalations. So, when the exhalations are longer, that is something that awakens the relaxation response in the body. That is something that activates the parasympathetic tone of the body. Let your eyes be closed. More than the lower abdominals rising, think about the upper abs rising. because that is when you that's a sign that you're actually able to stimulate the diaphragm better. As you inhale, the diaphragm is going down, pushing the upper abs up. As you exhale, the diaphragm is going up and your stomach muscles are sinking. Inhaling, diaphragm going down, upper abs rising, your block rising. Exhaling, diaphragm going up, upper abdominal sinking, your block and book also sinking. Let's do it with a few counts. Inhale, 2, 3, 4. Exhale, 2, 3, 4, 5, 6. Inhale, 2, 3, 4. Exhale, 2, 3, 4, 5, 6. Inhale, 2, 3, 4. Exhale, 2, 3, 4, 5, 6. Inhale, 2, 3, 4. Exhale, 2, 3, 4, 5, and 6. Gently remove the the block to the side and grab your rope or dupatta or belt. What we are going to do here is we're going to keep the arms out straight, holding the rope. Inhaling, stretch the arms out. Exhaling, get the arms down. Inhaling, stretch the arms open, lift the ribs, feel an opening in the armpits also. Exhaling, lowering the arms down. Let's do this movement 10 times. Inhaling deep, 3. Exhaling completely, 4. Make sure that your arms are in line with the shoulders, not too spread wide apart. Inhaling deep. Exhaling, arms coming down. Keep the elbows straight, let the elbows not bend. Inhaling deep. Exhaling completely. Inhale. 6. Exhale. Inhale. 7. Exhale. Inhale. Exhale. Inhale. 9. Exhale. One last time. Inhaling. 10. And exhale. Get your arms down to the side. We're going to end with one Shavasana. In Shavasana, you want to take a little distance between the feet. Keep your arms a few inches away from the body. Make sure your eyes are closed and your body and mind is very quiet. If your lower back is aching, you can keep the knees bent or take a pillow beneath the knees. Just take soft breaths. No deep manipulation of the breath. No counts, just soft, gentle breaths. As I speak about each and every part of the body, just send your attention to that part and release the tension in that part. Relax the toes, the soles of the feet, the heels. Relax the ankles, the calf muscles, the shins. Relax the knees, the hips, the thighs. Relax the entire pelvic area. Relax the lower back, the middle back, the upper back. Relax the stomach. Release any tension in the chest, intercostals. Relaxing the collarbones. Relax the shoulders, the armpits. Relax the biceps, triceps, the elbows. Relax the forearms, the wrists, the palms, the fingers. Relaxing the neck, throat. With every inhalation, feeling the prana flowing in the entire body. With every exhalation, feeling the negativities, toxicities, tensions flowing out. Relax the facial muscles, the area around your eyes. That is a site where we often hold unnecessary tension. Let the pupils soften within. Relax the nose, the cheeks, the lips. Let the tongue soften within. Relax the forehead, ears, jaws, chin. Relaxing the top of the head and the back of the head. The entire body is completely relaxed. Your attention is on the soft breathing, natural breathing. Should there be any strain remaining in any part of the body, just take your attention to that part and allow it to release. Gently now shake your toes and fingers. Get the legs together. Bend the knees. Turn to one side completely. Using the support of your arms, come up to the seated posture. Let us end this session with 3 Omkars, one Shanti mantra. Get your hands in Gyan Mudra. Close your eyes. Let's do our 3 Omkars together. On your next deep inhale, the Shanti mantra. Om Shanti Shanti Shanti. Gently rub your palms, cup your closed eyes, open your eyes within, and get the palms down. Thank you. If there are any questions, please let me know. Yes, you can unmute yourself and ask the question. The host, can you unmute? Um, okay, I don't think there are any questions. We can end now. Wishing you all a very happy International Yoga Day in advance. Okay, we can end the meeting now. Prabhu, do you want to end the meeting?